Welcome back, everybody, to another deep dive. This time we're diving deep into something that impacts millions and millions of people around the world. Diabetic foot ulcers.
Yeah.
Probably a lot of people out there listening know that diabetes is all about blood sugar,
Right.
but they might not know that it can make healing even small wounds a massive challenge.
Absolutely. And the fascinating thing here is that it really all comes down to something called microcirculation. And microcirculation is those tiny blood vessels that deliver oxygen and nutrients to your tissues.
Okay.
When those little vessels are compromised, like they are in diabetes, it's almost like trying to build a house with a shortage of trucks delivering supplies.
Oh, wow.
So healing just grinds to a halt.
So it's not just an inconvenience.
Yeah.
We're talking about like, it's going to take a little bit longer to heal.
Right.
We're talking about a 15% lifetime risk of developing these ulcers for anyone with diabetes.
It's a big number.
That's scary.
It really is. And unfortunately, some of these ulcers can persist for months or even years. Oh, wow.
And in some cases, they can lead to amputations, which is obviously a life-altering consequence.
Right.
It really highlights just how urgent it is that we find effective solutions to improve healing and prevent those outcomes.
We're not just talking about a little scrape healing slowly. This is serious stuff.
Exactly.
And I know there are treatments out there, but, what are the limitations? What are we up against?
So existing treatments like hyperbaric oxygen therapy or negative pressure wound therapy can be helpful.
Right.
But they do often come with drawbacks.
Okay.
They can be expensive, they require multiple sessions, and sometimes they can even cause pain.
So they're not very fun.
No, not always.
Okay.
So it's clear that we need more options, and especially ones that are comfortable and accessible.
Enter SoftWave TRT.
Okay.
Now, before you think this is just another ad, hear me out.
Right.
Their approach to treating diabetic foot ulcers uses something called extracorporeal shockwave therapy, or ESWT for short. You might be thinking, wait, shockwaves isn't that intense? Yeah, that's a common misconception.
Yeah.
The shockwaves in ESWT are actually very precisely focused pulses of energy that stimulate healing at a cellular level.
Okay.
Think of it as like a gentle wake-up call for your body's natural repair mechanisms.
So it's not about like zapping the wound into submission.
No.
It's about prompting the body to heal itself more.
Exactly.
Yeah.
And what's especially intriguing about SoftWave TRT's approach is that they use a very specific type of ESWT called electrohydraulic true shockwave technology. This allows them to actually reach a broader and deeper treatment area, maximizing the impact of those healing pulses.
So instead of just targeting the surface, they're going deep into the tissue, stimulating healing where it's needed most.
Right.
But how do we know this actually works? Is there science to back this up?
Absolutely.
Yeah.
There's a growing body of research demonstrating ESWT's effectiveness in treating diabetic foot ulcers.
Okay.
One study, for example, looked at how ESWT actually affected blood flow to the feet using a measurement called transcutaneous partial oxygen pressure, or TCPO2.
So they were basically checking how much oxygen was reaching those tissues.
Yes.
Which is super important for healing.
That's crucial for healing.
Right.
And the results were really quite compelling.
Good.
After just 2 weeks of ESWT treatment, participants saw a significant increase in their TCPO2 levels.
Wow, only 2 weeks.
Yeah, and what's even more remarkable is this improvement wasn't limited to just one type of ulcer.
You mean it worked for ulcers of different severities?
Exactly. ESWT seemed to benefit both superficial ulcers and those that extended deeper into the tissue. And here's the kicker. The control group who didn't receive the ESWT, they didn't experience these improvements.
Oh, wow.
So that's pretty strong evidence that it's the ESWT making the difference.
So we're seeing improved blood flow, which means those crucial building blocks for healing are reaching the wound.
Right.
But there's more to the story, right? I keep hearing these whispers about ESWT and stem cells.
Yes.
What's the connection there?
That's where things get really, really exciting.
Okay.
So ESWT doesn't create new stem cells.
Yeah.
But what it can do is activate and mobilize the ones that are already present in your body.
Wait, so we have these little repair crews just waiting to be deployed.
Exactly.
And ESWT is like their bat signal.
Yeah, think of it that way.
That's incredible.
It's a fascinating process.
Yeah.
Now, while the exact mechanisms are still being studied, we know that ESWT triggers a cascade of events at a cellular level that ultimately lead to stem cell activation.
Wow.
It's almost like giving those cells a little nudgelin to kind of jumpstart that healing process.
All right. I'm officially intrigued.
That's it.
About improved blood flow, and now we're talking about activating stem cells.
Right.
That sounds like a recipe for some seriously impressive healing.
It really does.
But before we get too ahead of ourselves, let's talk about safety.
Sure.
Because obviously, safety is paramount.
Of course.
Especially for individuals with diabetes who might have other health concerns. Fortunately, the research shows that ESWT is generally safe and well tolerated.
Yeah.
So we're not talking about any scary side effects or anything like that.
The most commonly reported side effects are very mild and temporary.
Okay.
Things like slight redness, minor pain, or small bruises.
Okay.
Nothing that should deter anyone from exploring this potentially game-changing treatment option.
Gotcha.
And get this, it's non-invasive.
No needles, no incisions.
Oh.
That's a huge plus, especially for those who are already dealing with the discomfort of a wound.
Absolutely.
Okay, so far, we've got a safe, non-invasive treatment that boosts blood flow and calls in the stem cell cavalry.
It's pretty remarkable.
It is remarkable.
Let's talk about stem cells.
Okay.
They're like the body's ultimate repair crew.
Right.
Capable of transforming into different types of cells that are needed for healing.
Yeah.
Skin cells, blood vessels, you name it.
Yeah, makes sense. But how do we actually know that ESWT is activating these stem cells?
Right.
It sounds almost like science fiction.
I understand the skepticism, but there's compelling evidence to support this idea.
Okay.
One particularly interesting case study
Okay.
involved patients with chronic venous leg ulcers.
So we're talking about ulcers that have tried everything and just won't budge.
Exactly. Wounds that have been stubbornly resisting healing for a long time.
Wow.
These patients received weekly ESWT treatments over a period of 13 weeks.
Okay.
And the results were really remarkable.
Right.
Both ulcers not only showed faster healing, but also achieved complete closure.
Complete closure. Wow, that's a huge win.
Yeah.
Especially for these chronic wounds, it really highlights the potential of ESWT to activate those stem cells and jumpstart that healing process.
Exactly.
Amazing.
This case series, well, just one example,
Yeah.
really points to the exciting possibilities of ESWT in tackling those really difficult to treat wounds.
Right.
And it's particularly encouraging for those who may have exhausted other treatment options.
So it's not just about addressing the symptoms. It's about potentially tapping into the body's own regenerative power.
Exactly.
That's a game changer.
It is.
But I'm curious, how does SoftWave TRT's technology fit into all of this?
So SoftWave TRT is really a leader in the field,
Okay.
utilizing their unique electrohydraulic true shockwave technology to deliver those healing pulses with greater precision and depth.
Wow.
It's like upgrading from a standard sprinkler to a targeted irrigation system,
Okay.
making sure that those stem cells are activated exactly where they're needed.
I love that analogy. So they're maximizing the benefits of ESWT, making it even more effective.
Precisely.
But before we get too carried away with all this amazing science,
Right.
let's bring it back to the listener for a second.
Okay.
Why should someone who's dealing with a diabetic foot ulcer care about all of this?
Imagine this. You've been struggling with a stubborn wound that just won't heal.
Yeah.
It limits your mobility. It affects your quality of life. It might even keep you up at night. Now imagine a safe, non-invasive treatment that could potentially accelerate that healing, reduce your pain, and prevent those serious complications.
That sounds like a dream come true for anyone battling a diabetic foot ulcer.
It really does, and that's what SoftWave TRT is aiming for.
That's amazing.
Their approach, backed by compelling research and this innovative technology, offers a real ray of hope for those seeking a more effective and comfortable path to healing.
It's like you're saying, hey, your body has this incredible ability to heal.
Right.
Let's give it the tools it needs to do its job.
Exactly.
I love that. But I have to ask, are there any downsides to ESWT?
Sure.
Is there anything we should be cautious about?
Well, while the research consistently demonstrates ESWT's safety and tolerability, it's important to remember that, like any medical treatment, it may not be suitable for absolutely everyone.
So it's not a one-size-fits-all solution.
Exactly. Certain medical conditions or individual factors might make ESWT less suitable. That's why it's crucial to consult with a qualified healthcare professional to determine if it's the right option for you.
Right.
They can assess your specific situation, discuss potential risks and benefits, and really guide you towards the most appropriate treatment plan.
That's such an important point.
It is.
We're not suggesting that ESWT is a miracle cure.
Right.
But it's definitely a promising avenue worth exploring.
Absolutely.
Knowledge is power, and understanding your options empowers you to make informed decisions about your health.
I completely agree.
Okay, so we've talked about the science, the research, the potential benefits.
Mm-hmm.
But I want to take a moment to acknowledge the emotional toll that diabetic foot ulcers can take on a person.
You're absolutely right. These wounds aren't just physical. They can impact every aspect of a person's life.
Yeah, the constant pain, the limitations in daily activities, the fear of complications, it all adds up.
It's crucial to address the emotional and psychological aspects of wound healing alongside the physical. Support groups counseling open communication with healthcare providers can play a vital role in navigating this challenging journey.
And that's where the promise of a treatment like SoftWave TRT shines even brighter.
Imagine the relief of seeing a wound that's been stubbornly resisting healing finally start to close.
Or the joy of regaining mobility and resuming those activities that were once limited by pain or discomfort.
Those are the stories that fuel our passion for exploring innovative solutions like ESWT.
It's about restoring hope and giving people the opportunity to live their lives to the fullest.
Absolutely.
But I think we've kept our listener waiting long enough.
Okay.
Let's finally dive into some of the specific research that supports these claims about ESWT's effectiveness in treating diabetic foot ulcers. Okay, so let's get into the nitty-gritty of the research. We've talked about these amazing results.
Yeah.
I'm sure our listeners are wondering,
Right.
Where's the proof?
Right. So let's look at a study that focused specifically on diabetic foot ulcers and ESWT's impact on microcirculation. Remember that TCPO2 measurement we mentioned earlier?
Yeah.
The one that tells us how much oxygen is reaching those tissues?
Right, the fuel for healing?
Yes, exactly.
Okay.
So in this study, researchers measured TCPO2 in patients with Wagner grade 1 and 2 diabetic foot ulcers
Okay.
before and after ESWT treatment.
Okay, quick refresher for our listeners. Wagner grades classify the severity of the ulcer.
Yes.
So grade 1 is like a surface scrape,
Right.
while grade 2 is deeper, potentially reaching tendons or bone,
Yeah.
but thankfully not infected.
Exactly. And the study found that the group receiving ESWT saw a significant boost in their TCPO2 levels, starting from the second week of treatment.
Wow.
And these improvements continued throughout the study.
So more oxygen was reaching those stubborn wounds, giving them a better chance to heal.
Exactly. That's the key takeaway. And here's what's even more impressive.
Okay.
This positive effect wasn't limited to just one Wagner grade.
Okay.
Whether the ulcer was superficial or more deep-seated, ESWT seemed to have a beneficial effect on microcirculation.
So it's not a one-size-fits-all solution.
Right.
But it seems to work across a spectrum of ulcer severity.
Exactly.
That's encouraging.
Yeah.
But how do we know it was truly the ESWT making the difference?
And that's where the control group comes in.
Okay.
They received standard care without ESWT, and they didn't experience any significant improvement in their TCPO2 levels.
Oh, wow.
So that strengthens the case that ESWT is the driving force behind that enhanced healing.
So it's like comparing a garden hose to a targeted sprinkler system.
Right.
ESWT makes sure that healing power is delivered precisely where it's needed most.
Yes.
So we've got the science, we've got the research, we even have some inspiring case studies.
Right.
But what does this all mean for our listener?
If you're dealing with a diabetic foot ulcer,
Yeah.
it's time to get informed and explore your options. Talk to your healthcare provider about SoftWave TRT and see if it might be right for you. Don't let these wounds control your life any longer.
It's about taking charge of your health and seeking out solutions that align with your needs and goals.
Absolutely.
Who knows? Maybe ESWT could be the key to unlocking your body's own incredible healing potential.
It very well could be.
And that about wraps up this deep dive into SoftWave TRT for diabetic foot ulcers.
Yeah.
We hope this information has been helpful for you.
We hope you learned a lot.
If you're dealing with this condition,
Right.
we encourage you to have a conversation with your doctor.
Absolutely.
Do your own research. And as always, thanks for joining us on the deep dive.
We'll see you next time.